So original Medicare, we're going to kind of talk on the basics of that, when people become eligible for it, when you should enroll, and maybe some couple additional things that can go with it. So original Medicare, that's going to be Part A and Part B. Part A is going to be your inpatient and hospital stays. Part B is going to be outpatient, doctor visits, imaging, etc.
Are there any like premiums or deductibles with Part A and B?
Yes. So in 2024, your Part A deductible under original Medicare is $1,632, and your Part B deductible is $240. There's also a Part B premium of $174.70. And there's typically not a Part A premium as long as you've paid into Medicare, the Medicare program, for at least 40 quarters. So if you've worked 10 years, paid in 4 quarters for 10 years, then that should cover your Part A premium. Part B, again, is $174.70. And the deductibles and the Part B premium that I just mentioned is, that's regulated by, Medicare is regulated by CMS, Centers for Medicare and Medicaid Services. And so it sets these premiums and deductibles every year. So it may vary from year to year. And then as far as a Part B premium, there may be IRMA for higher income earners, which is the income related monthly adjustment amount. So your Part B premium, you may pay a little more for that. And then Part D, you will need to enroll in Part D, which is the prescription drug plans, which we're not going to go over today, but your Part B premium may also be a little higher because of IRMA. So we can talk about that. We'd love to help you with these plans and your Medicare planning. So on the flip side of that, there are government programs to help individuals with lower incomes that can help pay some or all of your Part B premiums and co-pays, and also the prescription drug assistance program through Social Security called Extra Help. Those government programs are available, and again, we can talk to you about that. Just give us a call. And then after the deductibles for Part A and B, you typically, the government covers 80% of your Medicare approved healthcare costs, and then you pick up the other 20%.
And for that Part B and Part D, when you're not eligible, do people have to enroll in those or at that time, or can they wait if they don't have prescriptions now? Can they wait later and enroll in a prescription drug plan?
So there are late enrollment penalties. If you do not enroll in Part B and Part D when you're first eligible, then there are late enrollment penalties for not enrolling. And there are limited exceptions when those penalties do not apply, because usually those are lifetime penalties, yes.
And I know you mentioned that the government will cover the 80% and then the policyholder is responsible for the 20%. Is there a cap on the 20%, or how does that work?
There is not a cap under original Medicare. That is a 20% unlimited amount. So heaven forbid something catastrophic happens, even cancer, you're talking thousands of dollars, tens of thousands of dollars. So you will want to you'll want to cap your max out of pocket through a supplement, also called a Medigap plan, or a Part C Medicare Advantage plan, which we're not talking about today, but we can help with those plans. And your supplement, now the supplement plan G is the most popular plan now currently. And it covers your Part A deductible. It covers the 20% of Part A and Part B, but then you are responsible for the $240 Part B deductible. So that's your maximum out of pocket. And the supplement premiums typically, especially starting out, are reasonable typically. And so again, that's just something that we'll go over when you give us a call, so we can help with that.
Yeah. On those supplement plans that you were mentioning, I know the open enrollment period, it's the 6-month period that starts with your birthday month. If you're a retiree, it would start with your Part B. Whenever you gain that, that's when that open enrollment period would start. And let's say your birthday is October 1st. Your open enrollment period would start the month before your birthday. So you would actually get to start September 1st instead of October 1st, since you're at that beginning of the month period, to kind of give you some time to figure everything out.
Yes.
That's right. So when you first enroll in Part B, you're turning 65 or you're retiring. That's when it's going to trigger that 6-month period starting from that month. That's exactly.
And what is important about that 6-month period is there's no medical underwriting during that 6-month period. So should you have medical issues, they're looked past during that first 6
You're
months.
not considered at all.
Right. Whereas if you say a year later, after you're eligible, you want to look at a supplement plan, there will be medical underwriting, and you may or may not qualify for one of these supplement plans. So that's something definitely to consider.
I really want to use that open enrollment period for sure. It sounds
Yeah, it's very important to know about that and consider it. So again, yes, definitely want to look at that.
So these supplement plans, whether if I enroll in a supplement plan or because I have Part A, which is going to be inpatient, which of those would cover the needs for long-term care?
So Medicare does not cover long-term care at all. And so that's another thing that we can help you with, our long-term care plans. There are plans now that are trending, they're newer, where you get a cash benefit amount that's paid to you, and then you pay for your long-term care. So the idea is, take a portion, smaller portion of your portfolio, pay for the long-term care plan. It's done. You own it for a much larger payout in the cash benefits for long-term care. And that really protects your assets and investments to continue to kind of generate what they're already doing. So please call us for those plans. And we do have the reimbursement plans too. So love to talk to you about the long-term care planning.
Right. Circling back to, original Medicare, who's eligible? When should they start looking to enroll?
Right.
What's the timeline for that?
So call us at least 6 to 8 months before you're turning 65 or you're new to Medicare. Call us a year before if you know that you think that your Medicare is going to start, because you may need to enroll in Part A and Part B. And typically Social Security will tell you, okay, 2 months before those need to start, that's when you need to enroll. If you're not already automatically enrolled because maybe enrolled in Part A and Part B, because maybe you're already receiving Social Security benefits or you're opting in to receive them. But those are the sort of things that we can help navigate through. So yeah, you'd want to contact us at least 6 to 8 months before you get started with Medicare.
And that's for individuals turning 65, retiring, maybe coming off their employer group coverage, individuals who receive Social Security disability, they're eligible for Medicare.
Mm-hmm, exactly right. And we can navigate through all the, we can help you, make you aware of the programs and help you through the plans and looking at plans. So you can call to enroll in Part A and Part B, or you can go online. You create a Social Security account and then a Medicare account, and then you can enroll through those sources through Social Security in Part A and Part B.
So what does it look like for someone who maybe didn't work, or they were married and they chose to stay home and be the homemaker? What does that look like as far as eligibility goes?
So typically, even the spouse that did not work is typically eligible for Medicare. So it's a good idea to call Social Security even before they'll let you enroll in Medicare Part A and Part B, just to verify that you are eligible so that you can kind of work out the kinks. Because, I had a situation where the one spouse did not work. She was told she didn't qualify, but then we were able to tell her, yes, you should, because you're part of, it's a partnership. You're part of a married, you're married, and the husband owned the business and did most of the work when it came to their business, and she indeed was eligible for Medicare, and she got enrolled. So, yeah.
So I think the overall takeaway from today is, you may not be turning 65, but I promise you somebody is. There is a lot of information and it's really kind of individualized information as well. So we would really love to be your partner during this time, and just give us a call. Let us help you navigate this Medicare craziness.
Yeah, absolutely.